And I listened to probably, I don't know how many interviews, and these were with people that had had experience of violence or sexual violence during their transit through Mexico. So I got to code those, and I also got to learn how to facilitate interviews while I was there through this experience, because it's one thing to ask a very scripted series of questions, and that it's an entire another thing to let a kind of free dialogue flow, especially on such a sensitive subject. Again, it might sound a little political, but it's entirely true, that the United States stepped back in what their administration is doing. So in January of last year, they implemented the Migrant Protection Program, the MPP, and what that basically did was do the opposite of protect migrants that had transited through the country and were now on the border. It put them at further risk by returning them back into very dangerous places of Mexico, clearly identifiable clothing, folders from having been to the United States seeking asylum. Throughout Mexico, there are migrant shelters, and these shelters make up a very rough network through the country, and they're on very transited pathways for migrants to transit through the country more safely than other pathways that they could take. But unfortunately, this network is kind of broken. Most of them are individually run, and while some shelters have a full kitchen, they have a doctor on staff, they have free food, free medical care, free STI screenings or pregnancy tests, other shelters might have a place for you on their floor. So to improve this network, I think would be a really big next step. People are here one day, they're gone tomorrow, and every day is a new place for them, because their ultimate goal is to either find a place in Mexico where they can be sustainably employed, or to make it to the United States. So with this being said, it really did make me realize just how vulnerable the population is, and just how imminent that sense of their invisibility is. So when we see things in the news about migrants, it's usually things that criminalize them or demonize them, but not talking about their well-being or their health or the children that are also affected by large migration, and being able to work with that population and serve that population, and at least trying to give them a little bit of visibility in order to try to help protect them or help them protect themselves, I think is extremely fulfilling.